I'm Emma Burke. I work in speech and language therapy as a team leader for Community and Voice. My special area of interest is around motor neuron disease and working with people with dysphagia. The benefits of Agile Working for me are definitely around the fact that I don't need to start or finish my day at base, so I can be more flexible during my working day. The other thing is that I've probably cut my travel down by half, so it's cost saving in time and money. Benefits for the service users and carers, it means that I can access up-to-date information on the clinical systems when I'm actually seeing a patient. The nursing staff can also request information about other patients that may not be on my caseload, and I can give them up-to-date information about waiting lists or the therapy that they're receiving at the present time. I think that gives a better quality of care. The Agile Working project has made me think differently about the ways I work. For example, I spend time in a nursing home, such as Springfield where we are today. I can look at doing more than one task in one place without the travel, going backwards and forwards to base. So I can be seeing patients, updating clinical systems, checking emails, responding to telephone contacts, things like that. Agile Working has made the service think about different ways of working, looking at being more productive and more efficient. It's not just about seeing more patients and reducing travel, but looking about how we can save money around printing, the time that we spend email, for example. I think the main challenge for the service was changing people's mindset and then equipping them with the devices and making them confident in using those. I think being enthusiastic, leading by example and looking at the benefits that the service can gain from this project have been an enormous help. I think the best thing about Agile Working is having the time to care. The advice I give to somebody starting on the Agile Working programme would be to work in partnership with the Agile Working team, to go and request information from them and advice, and to drive your service forward.
The Agile project has enabled both myself and my team to work more flexibly, certainly. We're much more visible to clients, we're able to work out and about more from children's centres. It's improved our work-life balance in that we can be flexible in our work with our working day. The challenges we faced really are, more in terms of integrated working, are that some services are not using the same systems as us, but we're aware that the local authority are going to be using System 1, and that will have a huge impact on being able to share the same records, having access to other services records, and so we can look at information and share information more effectively. I think the challenge in terms of connectivity has also been an issue, and I know that is improving, and there's going to be changes to that, and that's something that we're looking forward to moving forward with. I think if someone was new to Agile Working, I think it would be really important for them to recognise that it's not a straightforward pathway. However, its benefits, once you become really involved and you embrace the changes, are really beneficial both to us as individuals and to our clients and families that we work with, in that we're much more visible to them, we have much more flexibility in our day, and even though there are challenges, and there will continue to be challenges, it's an evolving process, and if we embrace it on a daily basis, things will be much more improved for the service. Agile Working does have an impact on communication in a team setting, just because we're not seeing each other as regularly perhaps as we did, and I think it's really important that we make a conscious effort to communicate regularly. We have used lots of different systems for that. We use the link system regularly, we message each other, and we keep in regular contact just so we're ensuring we're sharing information. As a team, we've really made an effort to discuss with clients and families about using our devices within the home. So we've asked their permission, we've written records up together, they've had a say in what's recorded in their records and made sure they're happy with how we've worded things. It's a very open relationship, and we've made a real effort to ensure that relationship is not compromised by having a device there. And I think it's a great way of working, and I think clients are becoming much more happy with devices being used in the home, and more aware that that's how we're going to move forward in the future. I think the best thing about Agile Working is the improved communication we have with other professionals that we work with. We're able to work in a much more integrated manner, we have instant access to records so we can share information that's relevant to clients, and it's really helped cement our relationship with other professionals that we work with.